WRSR, Owasso, Flint. The following program has been pre-recorded and is paid for by Discover Flint Township. The views expressed are those of Discover Flint Township and do not necessarily reflect the views of 103.9 The Fox or Krill Communications, Inc. Welcome to Discover Flint Township, a program showcasing our local community. Flint Township is ready for your next move. And now, your host, Flint Township Economic Enhancement Director, Tracy Tucker.
Well, welcome this morning. I'm Tracy Tucker, and this is Discover Flint Township. Brought to you by Flint Township Economic Development Authorities, HAP, Financial Plus Credit Union, and Shea Automotive Group, and also 103.9 The Fox. We're wide awake, and we hope you are too. All right, during our Guaranteed Rate Business Spotlight segment, we feature a local Flint Township business every week, and today we have Jill Maxwell from Maxwell Therapy. So, Jill, why don't you introduce yourself and let everyone know what your role is at Maxwell Therapy?
Okay, my name is Jill Maxwell, as you just said, and I'm the owner and operator of Maxwell Therapy.
Okay.
We are a primary physical therapy clinic, and we also offer occupational therapy, speech therapy, massage therapy, laser therapy, as well as wellness memberships.
Oh, awesome. So, wow, that's a lot. That was a lot to sink into my brain there. But let's start out with, where are you located?
We are located at 1397 South Linden Road. Mm-hmm. in right off of Corona and Linden Road. And then we also have a location in Grand Blanc, and that's off of 8273 South Grand Blanc Road, which is just on South Saginaw and the corner of McCandlish.
Okay, over by Trillium area, right?
No, it's across from El Patero.
On
South Saginaw.
Okay. Yeah. See, I'm not from Grand Blanc. I'm from Flint Township.
Yeah.
That's okay, though.
Yes.
So, well, you offer a lot of services there. So how many employees do you employ overall?
Close to 40.
Wow. That's fantastic.
Yeah, 35. And then I have some massage therapists.
Okay. Now, are you the only owner, or is it?
I'm it.
You're the small business right there. That and it's been so difficult for everybody, and I don't want to get into COVID because you know what, I'm tired of talking about it. Yeah, so we're just going to talk about your business today. So you provide physical therapy and all these occupational therapy and all these things. That's a great option for people who don't want surgery, but how do you know when physical therapy is the right thing for you?
Most people don't want surgery, and a lot of people have both acute or chronic pain. Okay. So as far as physical therapy, what I usually tell people is if you have pain in your back, neck, shoulder, knee, and it's more than a 5 on a scale of 10 and lasting for more than a couple weeks, that's something that could warrant physical therapy.
Okay. All right. And you talked to me about the stages of healing.
Yes.
So what does that mean to your clientele?
Well, whenever you get injured, there are stages of healing. And the first stage of healing is pain and inflammation.
Right.
Okay. And then the second stage of healing is first we have to reduce the pain and inflammation. Mm-hmm. And then during the second stage, we have to restore the range of motion or the mobility and the strength. And then thirdly, we get back to our normal functions such as golfing, swimming, gardening. So what happens is a lot of times during the first stage, you have pain and inflammation. And that's usually the number one reason that people will seek physical therapy, is that they're having some kind of pain. And
so do they need to have, I think most insurances cover physical therapy,
yes,
right?
Yes.
Do they need to go to their regular doctor to get prescribed physical therapy, or is that something they can come to you and you work with their insurance company? How does that work?
Well, as far as insurance and legally in the state of Michigan, physical therapists can evaluate and treat for 3 weeks or 10 visits without a prescription. Okay. But the kicker is that most of the insurances require the prescription in order to pay.
Okay.
So most people would like their insurance to pay.
Right.
And so then they need to get a physician prescription.
Okay. So they can just go to their doctor and let them know what the problem is and that they want to come to you to seek your services.
Yes.
And they can get a prescription that way, right?
Right. They can get a prescription. Usually the doctor will just fax us an order, or they'll hand the prescription to the patient. Sometimes if people aren't sure if they qualify for physical therapy or if they need physical therapy, or what are we going to do for them? They can give us a call and we'll bring them in for, we call it a discovery visit.
Okay.
And we'll check them out and see if there's somebody that would qualify for physical therapy.
Okay. Before they even go to their doctor.
Before they go to their doctor, and then we'll have them go to the doctor. Sometimes people will have a condition that they've been treating for. Their doctor's aware of what their problem is. And sometimes we can just call the doctor, or the patient can call the doctor, and they'll just go ahead and fax over a script if the doctor is already aware and has examined them.
All right. Well, I kind of got off track here because, that's kind of how I do things. So you've already talked about the types of services you have, but when you get into the types of therapies you have several different types of therapy. One of them was dry needling, and I thought, what is that? So I'll let you talk about what that is.
Dry needling is an alternative medicine techniques similar to acupuncture.
Oh, okay.
But the procedure is performed by a licensed physical therapist that's been trained in dry needling, and it focuses more on the neuromuscular parts. So it's similar to acupuncture, but not the same. Okay. And so we're primarily reducing the tension in the muscles and or inflammation and pain by inserting the needles. It feels like a pinprick.
Yeah, that's interesting. I just saw that and I'm like, what in the world is that? So, and then the other thing you had, it was, and I'm probably going to murder this because I am not a doctor and I don't know anything about medical vernacular, but it's craniosacral therapy.
Yep, cranial sacral therapy.
Oh, it was close.
Yeah.
Okay. So what is that?
So cranial sacral therapy is a manual therapy technique. So where we use light pressure throughout the body.
Okay.
And we are able to feel there's a natural rhythm of the body where the body expands and contracts. And it's connected to all the fascial system, which is the network of connective tissue throughout the body that sometimes will tighten down in certain areas and end up causing pain or discomfort or dysfunction.
Okay, so that's more of like almost like a massage type therapy. Okay, all right. And what is somato-emotional release?
Somato-emotional release.
See, I got that wrong too.
Yeah. Yeah. Somato-emotional release is part of the training with the cranial sacral therapy. So when you get injured or when you have a trauma or a fall or an accident, often there's not only the physical injury, but there's also emotions that are kind of stored in those muscles and those tensions. So like it's called tissue memory.
Right.
Okay. So sometimes, I work with abused people who've been abused, and or people who have had just a traumatic injury, a car accident or something. And it's not just the physical muscle tension, but the emotional that's associated with that. And so when we release the physical tension, then often people also will have an emotional release. And, they say tears are made for cleansing. Yeah. And so at times I'll have somebody come in and we, go through a very, keep it simple process for stress management and teach them how to process their emotions in a healthy manner so that they don't suck it up, stuff it down, and tense up their body. And when they do that, at times, they can go from a 8 to a 2 as far as a pain level because they've just released that tension emotionally. Right. And it's all, I say, interactive and interdependent. So your emotions and your physical body and your mental state are all intertwined.
Yeah, and that stress that you're feeling from that is can be horrible on your body. Yeah.
Yes, and anybody going through a medical condition, it creates a significant disruption in your life.
Yeah, exactly. So the other thing you had was neuropathy treatment.
Yep, neuropathy.
I knew if I said it that way, it would be wrong. I knew it. I thought if
should
I
have
say
reviewed.
neuropathy, it'll be neuropathy. So I'm going the other way, and I'm always wrong when I take that path. But okay, so what is that?
Okay, neuropathy is basically nerve damage.
Okay.
Sometimes for known reasons, such as diabetes, when your sugars are off and you're not managing your sugars, you start getting neuropathy in your feet. It's pain, tingling, numbness, burning in your feet. And eventually, you when you have numbness in your feet, then your balance gets off, and so forth. You numbness in your hands, you drop things. And so we have a treatment that we do for that is wonderful, especially for the diabetic neuropathy.
Okay.
Okay.
All right.
And
so you have so many great programs there, it sounds like. How can our listeners get in touch with your businesses?
well, they can just give us a call at 810-230-9750.
Okay.
Or they can check us out on our website. It's just maxwelltherapy.com.
Easy.
Yep. And
Easy to get a hold of.
Facebook, we have a Maxwell Therapy Facebook page.
Yeah, there's a theme there. Maxwell Therapy. Easily.com or on Facebook.
Yeah.
Or they can call.
Mm-hmm.
And before we finish up, anything else you want to talk about? Anything we didn't talk about that you wanted to get out?
I just want to let people know that they do not have to be in pain. There are many, many options that we offer people to help relieve the pain so they can get back to their normal function. And it's absolutely worth a try.
Yeah, there's so many different therapies and stuff out there for people to try.
Yeah.
They really should look into it. I mean, the information's out there. If you've got something going wrong, go to your doctor, because I am not a doctor. As Bridget always says, I'm not a doctor. So go to your doctor and find out, or call Jill at Maxwell Therapy and get a consultation discovery appointment. And they can talk to you about whether or not your issues are something they can treat. And I think that's great. I have never had to have physical therapy done, knock on wood. But I think it's a great way to avoid surgery and all those other messy complications that you can have that are related to that.
Yep. People are tired of getting injections, tired of being in pain.
I'm telling you,
And
I could. They can take those injections and do something with them.
Sometimes they can be, for some people, very effective, and for others, not. So this is just, we offer a numerous options, and our wellness program.
Yes,
For
that's
chronic
great.
pain.
That's great. And so I want to thank Jill for coming in, and I want to remind our listeners that if you have any questions or comments on the show, email me at discoverflinttownship@gmail.com, or visit us on Facebook at Flint Township Events. You can get all our shows on our YouTube channel, Discover Flint Township, and you can visit our web pages, discoverflinttownship.com or flinttownship.org. I want to thank our guests today, Stacy, Mackenzie, our people from Sloan Auto Fair, and Jill Maxwell that you just got to hear from. And I want to thank our partners, HAP, Shea Automotive Group, Financial Plus Credit Union, Guaranteed Rate, and 103.9 The Fox. Discover Flint Township with us next Sunday. And I think we have Financial Plus and the Popcorn Wagon on. So that'll be a good show, too. And then I want to tell you, I'm Tracy Tucker, the Flint Township Economic Enhancement Director. And I would like to remind everyone, stay safe, stay healthy, shop local, buy local, and discover Flint Township. See you later.
This has been Discover Flint Township with Tracy Tucker. For more information, visit discoverflinttownship.com. Flint Township is ready for your next move. The preceding program was pre-recorded and was paid for by Discover Flint Township. The views expressed are those of Discover Flint Township and do not necessarily reflect the views of 103.9 The Fox or Krill Communications, Inc.